I realized that this is such a rare scenario.
Let me carry your burden.
It never happened for an adult.
This was an extremely challenging case.
The combination of problems that Raif had is almost unheard of to the best of our knowledge.
My name is Raif. I'm a sickle cell disease patient. It all started this in one day. I got stomach pain, vomiting, and nausea. Then we went to the emergency in Oman. The doctors did their test and they said that they're going to do a minor surgery for me and I can go back home.
Our family were really surprised. What happened? I was at work myself. They called me telling me that my little brother is in a coma, and we really don't understand all this. How could it happen to a person in one day? Today you're fine, the next day you're fear of your life. Then every day we keep on asking if there's any updates. They're saying from a day to another, it's just bad news to another bad news. We don't know much of any, we haven't heard of this thing in our life.
Actually, this happened because of my sickle cell disease.
Sickle cell anemia is a genetic and hereditary disorder. This can lead to severe complications, particularly with painful crises, chest syndrome, stroke, and priapism. These severe complications can be treated by this procedure called red cell exchange, which is an automated procedure done by a machine. The clever technology behind it is to remove patients' sickle cells, which are affected by the disease, and replace them with clean and healthy cells. The procedure takes few hours and is not labor intensive.
Some sickle cell patients, they get like what they call thrombus in their veins. I got this thrombus in my small intestine. And this is very rare, like in adults. So they wanted to do a surgery to find out what is going on inside. So what they did is not an open surgery. They did what they call laparoscopic surgery. And they said that they're going to wait for me to wake up and see how I feel. After the first surgery, I woke up. I was like, you guys didn't do anything. I'm still in pain. I'm even worse than when I came. So at that moment, they decided to do a second surgery. The human body can't handle 2 surgeries in less than 24 hours. So like I was really weak and really suffering to breathe, and so they had to intubate me and put me in a coma. So they did that, and they said hopefully things get better with time.
So because of Raif's sickle cell disease, his blood tends to be a little sticky, and that means he can form a blood clot. And at this time, he'd formed a blood clot or thrombus in the vein that drains his intestine. When that happens, pressure builds up and the lining of the intestine becomes very fragile. It can actually undergo what we call necrosis, which basically means the bowel dies. In that case, there's only a limited number of options, and the timing of decision making is really critical. Unfortunately, by the time it was recognised that Raif's bowel had died and needed to be removed, he was very sick on the intensive care unit and unable to undergo surgery. This left him in a very unique situation where, over time, this dead bowel changed into a bit of a cocoon. So it was just an empty sac within the abdomen with all of these fistula tracts, these abnormal connections to different parts of bowel. And when we look at a scan, we could see that the remaining viable or useful bowel he had was very short. So he only had around 20 to 25 centimeters and a little bit of colon.
Yeah, so they had, like we said, we have to operate again on him, and just will put a tracheostomy on him because he's having difficulty of breathing. He got what that defense in your chest? They call it?
Pneumonia, they call
Yeah.
it.
What brought you to Dubai? You were saying that your surgery, your first and your second surgeries were in Oman.
Actually, before even Dubai, we went to another country.
Yeah.
We were looking everywhere because the doctors, they were telling us, we don't know what to do. We have
So-
reached to a situation we don't know how to do. We don't have the treatment here. We could help you and send him abroad.
Yeah.
They sent him abroad.
The government, my government, Oman government really helped us, and the doctors that were taking care of me, I can't really thank them enough. In Oman,
But
I like to believe like they're part of the solution, and they really helped me. They really fighted for me to take me abroad, and where they took me is to India. So we went, me, the patient, my mom and dad, and of course, like we were saying, whatever happens, happens, and we went through it, and India did all their tests, and they told us the same thing. What in Oman, they can't do anything.
the
What
thing that
they can do is what they suggested is to do a bowel transplant, like to remove the whole bowel, my whole bowel, and put other person bowel. And we were like, so the government in Oman, they feared for my life, and they said it's a high risk surgery, and the percentage of passing the surgery, it was like really low, like really low. So we didn't want to take that risk, so we said we'll just go back to Oman.
One of the options presented to Raif and his family before coming to us at King's was to have an intestinal transplant. Now, whilst this is the right decision for some people, we felt that we could offer some other options that had a better chance of improving his quality of life and improving his length of life. If it came to the point of needing an intestinal transplantation, we can offer that, but we want to make sure that we're doing the right procedure for the right patient at the right time, always.
At that time there were no any alternative.
There were
options.
no any, like I was
Just
go back home and live with the whatever.
They stopped him, of course, of eating anything. He was not eating anything at all the time. But they made what do you?
I
call this thing?
I
What?
couldn't eat, or even if I put water in my mouth, I would like straight away vomit. I was like just living on ice cubes and TPN, what they call this TPN, total nutrition. And
They had to feed him through his veins.
So they provided us with a pumping machine and the stand, and basically you can say our home got transformed into a hospital.
It was very difficult times for a very long period of times, more than a year. And until there, every day we woke up, we don't know, okay, what's the next step now? What to do? We have gone everywhere in the country. We tried out of the country. They told us there's nothing. But honestly, the whole family didn't give up. We kept on praying and praying until, sorry.
Until my father found a hospital.
We called the hospital there. When they asked, where is this patient? We sent him the scans. You know what was the first answer of the email? They said, is this person alive? After seeing all the x-rays, all the MRIs, and then we said, yes. They sent us again. Are you sure? They're asking if this person is still alive. We said, yes, he's still alive. They said, okay, what we can do, we'll recommend you to a doctor in King's Hospital, but not in London. It's in Dubai, and it's near to you. We emailed the doctor. The doctor is Dr. Lisa. She immediately responded to us and requested if she can see the patient immediately.
So I first heard about Raif's case from a colleague I used to work with closely in London, who told me about this poor boy with a very, very unique circumstance, who was from the Middle East and was struggling to find someone to help him out of the really difficult situation he was in. So I got the full background details of the case, looked at his images, met with the family, and realised this is not something we've ever seen before.
The same day, me and my father drove from Muscat. We came all the way to Dubai. We reached here, we met the doctor. We brought all the reports and everything. She said, there is hope. This small word, hope. When she said that, we were over a year just want to hear that one word. We want to hear hope. There is hope for this guy. She said, yes, there is hope. I can come up with the team, and when can you bring him? Of course, immediately we went back home. We told them that they told us there is hope. We decided to come the next day.
I'm never going to forget this day when I met these three doctors. Dr. Basim, Dr. Atif, and Dr. Lisa.
When I met Raif for the first time about 6 months ago, this case was presented to us from Oman. This was an extremely challenging case,
where a lot of his bowel ended up literally dying within his abdomen.
and in my 24 years of experience, I've never seen a case like this.
And for about a year after the incident, Raif couldn't eat normally. And he'd been to other centers and really could not find the help that he needed.
And when I first met with him, he just told us that all he wanted to do was to be able to eat a burger.
Reviewing his scans, he had multiple fistulas. The entire central part of the abdomen was eaten up by necrosis of the small bowel. He had 4 fistulas, one from the jejunum, one from the sigmoid colon, 2 from the transverse colon, and 1 from the terminal ileum. So all the 4 fistulas were opening into the necrotic cavity. We had some idea about the surgery preoperatively through the CT scans, but the real horror story was seen when we opened him up.
When we first saw Raif last year in 2025, lovely gentleman, lovely family, and all Raif told me was, I want to eat, I want to eat, I want to eat. And we as a team, as a multidisciplinary team here at King's, we're made up of our gastroenterologist, adult surgeons, and myself, the pediatric surgeon. He said, look, we are going to aim for 2 things, Raif. We're going to aim for you to be able to eat, and we're going to aim for you to reduce your dependence on the intravenous nutrition that you're taking, because Raif has to be hooked up literally every day to an intravenous nutrition that will supply him with the nutrients that he needed just to remain alive. And I said, these are our 2 goals, Raif. But these 2 goals have to come under one umbrella. And that umbrella, Raif, has only one word on it, and that's safety. We are not going to do anything that will compromise your safety. And after several discussions, we agreed we will proceed. But we knew very well as a team that the operation, the first operation, was going to be really, really dangerous. And we had a good discussion with the parents and the family and Raif himself that things can go really badly during surgery. We do have the experience, we do have the abilities, and we do have the equipment and the skills to do it, but things can really go bad. And the family had to accept that at some point, and the decision was we'd proceed.
They took a risk Although everywhere were rejecting, nobody want to do this surgery, and they took the risk. They said, yes, we can do it. And it is not the first time he's doing it. He's doing this operation with the children in pediatric situation. But for him, it was the first case as an adult to be operated on these cases.
They had to do a
They have
lengthening.
to do the lengthening because the bowel was shrinked, was small.
The normal human being bowel is, as doctor told us, is 3 to 4 meters. What I have now is 45 centimeters remaining.
He said, I will take the risk. I will try to lengthening the bowel. But lengthening, we don't know how it will length, how far it will reach. Whatever will be there, we will start on that, and then slowly with the medication, with the eating, because he was not eating anything. With the food, it will return back to normal, inshallah, but it will take time. And we sign, it is very risky. Anything can happen on the table. But we don't have any solution unless just the patient have to sign.
I was an adult
Tuwakalna.
at that time, so I was past 18, so I had to sign the paper myself. And I was really worried, and my hands were shaking while signing the paper. Like, I was going to say, might be the last thing I'm signing. But
Correct.
thanks God, thanks to Allah.
So when it comes to planning his surgery, we know that it's going to be an incredibly complex procedure and we need to get multiple members of the team involved. So we have conversations with our surgeons, of course, our intensive care team, our haematologist, Dr. Shabiha, to plan the management of his sickle cell disease around the surgery, all of our nursing team and other health professionals.
We took this challenge after reviewing all his scans, and we performed an extremely difficult surgery. We excised all the fistulas, reconnected the bowels, and lengthened the jejunum, which was only 25 centimeters, so it went up to 45. We make out the anatomy and then rejoin it, reconnect it, and try to make things normalize. This was not an easy thing. I've never ever seen in my entire career this type of situation inside the abdomen, where most of the small bowel is just non-existing.
I would say that our senior management team here at King's was also very supportive that we proceed with this surgery that we were planning. And on the day we had well over 8 hours of surgery. What we found inside the abdomen, as we suspected, was this big mass of bowel that had literally died away, with several problems across the colon, and he had just about 25 centimeters of what we call the jejunum, which is the upper part of the small bowel. And that puts Raif in the category of short gut syndrome. We were able to sort out the abdomen safely, and we were able to do what's called a bowel lengthening. We were able to lengthen his bowel. But because of the severity of the condition, we had to come out with what's called a stoma, meaning we had to divert the poop that his bowel's making to the outside to allow the abdomen to heal. That caused him a lot of distress after the surgery because he was not used to it. Obviously, no one is. We had the specialist teams coming up to try to support Raif in doing that.
Before the surgery, I remember Dr. Basim and all the doctors, they came to me and they said, like, we're going to open you up and the surgery is going to be very long, and you're going to, after the surgery, you're going to be with a stoma bag. And that stoma bag, I had a really hard time with the stoma bag. I really want to thank all the nurses that really helped me. I really want to thank also Jessica, one of the nurses here. She really helped me a lot. She helped me with the stoma bag. Like, her shift ended at 5. She could stay even till 8, 7 sometimes and help me with the stoma.
So I was first introduced to Raif's case as part of an MDT meeting with our gastroenterologists and surgeons here. And I knew from that meeting that this was a rare case that was going to require a different approach because we're looking at a long admission with some complex surgeries coming up. Initially, I helped manage his intravenous access, so he had a port cath for his parenteral nutrition. And then I worked with the family as a liaison between the different healthcare professionals that were involved. After his first surgery, he had a complex high output stoma, and I was involved in managing his stoma care and his skin care and working with the ward to make sure that his output and his nutritional needs were met.
I'm not going to go into the nitty-gritty of the medical side of what we did, but I would say one thing. At the end, it was successful.
Raif stayed in for on and off for a few months, but his management slowly progressed, and after 2 or 3 surgeries, he was well enough to be discharged home.
We could not have achieved any of that without the patience and resilience of Raif and his family. This family is one of the most supportive families I have ever seen in my career. It's just amazing when the family is part of the team. It's one thing we try to do here at King's, is that we involve the family, the patient. They are not on the opposite side of us. They are part of the team. They are part of the decision making. And what made this very rare case, to the best of our knowledge, the combination of problems that Raif had is almost unheard of, to the best of our knowledge. It's almost unheard of. Yes, we know every condition he had, but that combination in one patient is almost literally unheard of. And the main reason that we were able to get through this is that we were one team with the family.
I'm happy and proud to say that we are very happy with the outcome, and hopefully we should be treating more of these kinds of patients in future.
They did everything for me. They gave me my life back. And Allah guided them, and they did the surgery for me. I started eating again, drinking water. I was so happy.
You know, he just wanted to be a normal 19-year-old boy, enjoy watching football and eating burgers, and I'm really happy to say that I think we've got him to that point now.